Hi, my name's Poppy Middlemiss and I work in the public health team at Hackney Council. I'm going to talk you through a presentation which we delivered recently at the launch of our community grant scheme, which is called the Healthier City and Hackney Fund and is delivered jointly with the Clinical Commissioning Group. This presentation is going to tell you a little bit about the partners involved in the scheme, the principles of the scheme, our different funding streams and priority areas which we're looking for people to bid to, and also a bit about the application process. So the Healthier City and Hackney Fund brings together two existing funds, one which was previously run by City and Hackney Clinical Commissioning Group, also known as the CCG, and that was the Innovation Fund, and the second, which was run by Hackney Public Health, called the Healthier Hackney Fund, and it's the first time that an NHS group and a local authority have pooled budgets together to deliver a grant fund at this scale. So the first partner, being the CCG, are the organisation who are responsible for all of the NHS services delivered in the City of London, which is also known as the Square Mile, and in the London Borough of Hackney. City and Hackney CCG have four overarching responsibilities, the first being to understand the health needs of the populations in the City of London and the London Borough of Hackney, so using all the data and research available to us to work out which of our communities are most in need and what their particular health needs are. They then use this information to facilitate the design and redesign of services which are targeted at particular communities and aimed at improving the health and well-being of those communities. They then need to buy these services, and they do this taking into account value for money principles. Once these services are being delivered, the impact of these services needs to be measured so that we know how well they are doing and to make sure they are targeting those communities that they are aimed at. The second partner involved in delivering and facilitating the Healthier City and Hackney Fund is Hackney Council's public health team. And as a result, I just want to share a little bit of our thinking around what is public health. The Faculty of Public Health's definition of public health is the science and art of promoting and protecting health and well-being, preventing ill health and prolonging life through the organised efforts of society. And we're particularly interested in the first part of this definition, that public health is a science and an art. So recognising that public health is about collecting data to recognise who we need to deliver our services to, but also it's an art, so we need to be creative about those services that we deliver. And the last part of that definition, through the organised efforts of society. So this is recognising that we need to integrate what we do and take ideas from people outside of those who commission health services. So to try and bring together the thinking of the CCG and public health in City and Hackney, we are running a large programme to try and integrate what we do. And this is called Integrated Commissioning, and it's bringing together the CCG, adult social care and public health. We are doing this under 4 work streams, and those work streams are prevention, which is basically public health and stopping people from getting ill, anything to do with children and young people, anything to do with planned care, which is anything that you need an appointment for, and anything to do with unplanned care, which is anything that might be an emergency. And the intention of this is to pool our budgets, and this scheme, the Healthier City and Hackney Fund, is one of the first to do that. So I'm now going to tell you a bit about the principles of the Healthier City and Hackney Fund and why we've chosen to grant fund in this way. So we recognise that City and Hackney's populations face many significant health issues, some of which have persisted for years, and that we term wicked issues. And these are problems which we haven't been able to solve through our usual commissioning routes, by putting money to the problem and designing and developing our services in-house. And we recognise that we need new minds from people who have a better knowledge of the local population and new ideas to try and solve these old problems. We have different funding streams with different intentions, but I'll talk a little bit more about that later. We want to make sure that patients and service users are at the heart of our services, so there's a focus of co-production in this grant scheme. We also involve the Public and Patient Involvement Network, which is part of the CCG. They helped develop the original Innovation Fund and the priorities for that fund. And we want these priorities to continue to be at the heart of the Healthier City and Hackney Fund. And these are integrated services, so recognising that we can't do this alone, building independence in our users so they have the confidence to seek help when they need it, which leads on to the next one, which is confident and informed users, so our users know what they need to do when something goes wrong with their health, and involving and listening to service users when developing these programmes, projects and schemes. So we have approximately £500,000 for grant making for projects to be delivered by the Healthier City and Hackney Fund in 2019 and 20. We've split the Healthier City and Hackney Fund into 3 funding streams, which are Healthy Activities, Healthy Ideas and Healthy Next Generation, which I will talk a bit more about in the next few slides. We also offer our successful grantees something we call Funding Plus, which is an offer extra to the monetary value that's given as part of the scheme, where we offer a single point of contact within the public health team or the clinical commissioning group who will give up 5 days of their time to support your project and be the link between us and your organisation. We offer specific help with comms support, and we're also always at the end of the phone or email to answer any queries or questions you might have. We also offer help with reviewing bids and parts of the application process. In terms of eligibility, any organisation that is not for profit in the voluntary and community sector, charities and social enterprises who reinvest 100% of their projects are eligible to apply. And we have a 2-stage application process for Healthy Activities and Healthy Ideas, and a 1-stage application process for Healthy Next Generation, which I will again talk about in the next few slides. The Healthy Activities stream is for doing grants, so your more traditional grants looking at projects that are delivering services. And we're offering up to £60,000 with a minimum bid of £5,000 for provision of activity relating to one of the 4 selected key issues. And these are workforce health. So this is recognising that we want to improve, we can improve workers' health and to help to get them out of poverty. And we want to fund eligible organisations to work with and support micro businesses, which is those that have fewer than 10 employees, and the VCSE sector with organisations fewer than 100 employees, to develop an effective and sustainable workforce health offer to improve the physical and mental health of their employees. So workforce health is a priority for us, and we want to aim to support local delivery of national ambitions relating to this by helping small businesses do what is best for their employees. So we want to avoid you working with larger businesses who already have a workplace health offer or who already have London Healthy Workplace Charter accreditation, and we want to avoid programmes which only provide information to employees. The second priority issue for this stream is supporting families to manage childhood illnesses closer to home. So we're looking for applications that aim to reduce A&E admissions or attendances, and that aim to empower families to prevent and manage childhood illnesses and to support them to do so with education and information, ensuring families are aware of appropriate pathways to access healthcare. We're less interested in projects that focus solely on one area of health and well-being, such as healthy eating or oral health, because that's another priority I'm going to talk about later in this presentation. The third priority issue for this stream is navigating health and social care for homeless people and rough sleepers. So this is recognising that ill health can cause people to be homeless, but also can be a consequence of being homeless or sleeping rough, and that many homeless people face real or perceived barriers to accessing healthcare, caused primarily by the complexity of the care system and the challenges caused by their transitory circumstances. And so we would welcome bids from VCSE groups that support homeless people to confidently access the right care within our local systems. We want to avoid projects that look at providing solutions for housing provision for homeless people and rough sleepers. We want to avoid projects that solely provide information and wayfinding for homeless residents, and we want to avoid general support services to homeless people and rough sleepers that are not health specific. And the last priority issue I need to talk about under this stream is supporting recovery following a life-changing illness or injury. So here we're interested in bids which support residents recovering from a life-changing illness or injury, such as cancer patients or people who've suffered head injuries, following clinical treatment and rehabilitation to aid their recovery and allow them to access mainstream services that will help to keep them well, such as physical activity provision. So we're looking to fill that gap between finishing clinical treatment and accessing mainstream services to improve those people's health and well-being. We want to avoid projects that work with stroke patients eligible to access our Fit for Health programme, and projects which simply provide navigation support or information about available local services. And the Funding Plus offer here is outlined as our single point of contact, skills support and communication support. The Healthy Ideas stream is offering up to £20,000 for research grants, so grants to test new ideas and look at where we've got gaps in knowledge, and then run a short pilot programme. So this is for radically new approaches to tackling entrenched problems relating to one of our 4 selected key issues. And these key issues are tackling loneliness in under 50-year-olds. So we recognise that we've got a really good offer for those over 50 with our Connect Hackney service, but we want to identify the factors that lie at the heart of loneliness as it exists in City and Hackney for younger people. We want to look at ways of identifying who is suffering and, importantly, identify assets that exist to alleviate loneliness, including how to make activities attractive to those who are lonely. And we want to avoid the services that we already have, such as Connect Hackney, Making Every Contact Count, social prescribing and befriending services. The second priority area for this stream is identifying people at risk of falls. So Hackney Public Health commission a falls prevention service, which isn't currently available in the City of London, and City and Hackney CCG commission a strength and balance service. And by their nature, these predominantly respond to someone's first or subsequent fall. We would like to better understand who is most at risk of a fall that causes injury and how to make falls prevention training attractive to those who've not yet suffered. We want to avoid interventions for those who've already had a fall, falls prevention in a clinical setting, falls prevention assessment in primary care settings, and general health promotion activities relating to falls or just navigation of these services. The third key area in this stream is improving health services for autistic people. So we recognise that autistic people can be disadvantaged when it comes to accessing health services, and access to healthcare provided for autistic people does not guarantee effective and appropriate treatment. There are positive steps that can be made by adapting services and communication to meet the needs of autistic people, and we are looking for bids that explore that. We don't want to pilot services we already have, such as the Adult Autism Service and Hackney ARC. We don't want projects which only provide training to health staff and projects which duplicate the work of the Autism Alliance, which is a local partnership of professionals with a remit for autism. And the final priority issue for this stream is oral health promotion in children and young people. So we are looking for organisations to test and develop pilot campaigns focusing on preventing poor oral health and improving practice within communities in City and Hackney as a research project. For instance, we're particularly looking for organisations to work with communities which we know have poor oral health outcomes, such as the Orthodox Jewish community or the Gypsy, Roma and Traveller communities. We want to avoid running oral health activities which we already deliver locally, such as fluoride varnish programmes for children or dental surveys of 5-year-old children, and broad campaigns relating to diet, smoking or other behaviours that influence oral health. So for this one, we require a proof of concept report and a short pilot, and we have the same Funding Plus offer, a single point of contact and communication support. We also offer challenge sessions where we get all of the successful grantees under this scheme into a room twice throughout the year that the grant is being delivered to challenge each other and offer solutions to problems you're having during the delivery of the grant. For the Healthy Ideas and Healthy Activity streams, we have a 2-stage application process. Stage 1 starts with a really short application form, which we call an expression of interest, where we ask for information about the organisation's eligibility, an outline of the project and who the project plans to target. These are then shortlisted, and we invite all those who are successful through that shortlisting to deliver a pitch to a panel where the organisation has an opportunity to show the passion that they have for their project and answer a few questions that the panellists might ask. We then shortlist again, and those who make it through that stage get to stage 2, which is the full application form. So this is a much longer application form where we ask for a lot more detail about project costs, delivery and outputs, and exit plan, and how is your project going to be sustainable. These are again then shortlisted and initial funding recommendations made. A final decision is then made by Cabinet at the Council and the governing body at the CCG. Our third funding stream is called Healthy Next Generation, and this looks at grants up to £8,000, particularly around childhood obesity. And like the Healthy Ideas stream, these also are research grants, so we're looking for a proof of concept report and a short pilot. This year, we're particularly looking for applications that focus on 2 areas, the first being a healthy weight in the Orthodox Jewish community. So we're interested in grant applications that explore barriers to physical activity for children and families in the Orthodox Jewish community by looking at the wider influences to physical activity, including the potential impact of cultural, social, and environmental factors. We want to use the insight gained in understanding of the barriers to physical activity in this community to help us achieve a sustainable increase in physical activity levels in children and families in the Orthodox Jewish community. We want to avoid weight management or weight loss or dieting programs, cooking programs, nutrition and healthy eating education, and exercise classes. The second area that we're interested in for this funding stream is supporting women to think about a healthy weight during pregnancy in a sensitive and safe way. Excess weight gain by women during pregnancy can be a particularly sensitive issue, but we know that maternal obesity is an independent risk factor for fetal maternal complications and has a longer-term risk for the child to be overweight or obese as they grow up. Again, we're looking to avoid doing projects, so projects around weight management or weight loss or dieting programs, cooking programs, nutrition and healthy eating and education programs, and exercise classes and diabetes training and awareness. For the Healthy Next Generation stream, we have a 1-stage application process, which is just the longer written application form, and that closes on the 7th of December 2018. All 3 funding streams opened on the 8th of October. On the 16th of November, we close for expressions of interest for Healthy Activities and Healthy Ideas streams, so you've got 6 weeks to get those in. And then on the 7th of December, we close completely for the Healthy Next Generation stream. We've set pitch dates for the Healthy Activities and Healthy Ideas streams, which are on the 10th, 11th and 12th of December. And then for the final application closing date for Healthy Activities and Healthy Ideas will be the 15th of January next year. We hope to make initial recommendations on the 11th of February following the shortlisting, and final decisions at Cabinet and CCG will be made in the week commencing the 1st of April 2019. We will then want contracts to start on the 1st of May 2019, so please note that this is slightly off financial year. We have produced priority issue briefings which are available on our web pages, which give way more detail on the direction in the aspects of each priority issue we want to fund, and a bit of detail on the areas that we want to avoid as well. All that's left for me to say is thank you for listening to this presentation, and thank you for your interest in the Healthier City and Hackney Fund. We are really excited to read all of your bids. Please do sign up to our newsletter, which we'll be sending out throughout the application process over the next few months. Please direct any questions to our inbox. The email address is public.health@hackney.gov.uk, and please apply by accessing our web pages. All the links you need are down in the description box below. Thank you and goodbye.